It's possible that genetic testing could play a role in the future when we have methods to modify the disease at early stages. Alzheimer's disease genetics are pretty complicated. There are two categories of genes that are at play. There are three genes that are autosomal dominant, so they're highly familial, and if you have the gene, you will get Alzheimer's disease. Those are very rare. Less than 1% of Alzheimer's disease is explained by those mutations, by those genes. However, there have been trials looking at people who have the gene and who aren't even symptomatic yet, because they might be people who would be most implicated or would be of most benefit to a disease-modifying therapy. There are other genes that play a risk factor role. They may not be have as much of an effect as an autosomal dominant gene, but on average they may impact the risk of late onset Alzheimer's disease by 4, 5, 6-fold. The most popular or common one is the apolipoprotein E4 allele, which has been known for quite some time. It's associated with increased amyloid deposition earlier on at younger ages. Right now we don't know how to harness amyloid ApoE4 positivity for therapeutic use, but there's a lot of research going on into how ApoE4 leads to amyloid deposition and how that leads to Alzheimer's disease. And so someday perhaps E4 targeted therapies would be of benefit.